In this video, I'll be showing you the major projection used in imaging Petrousmastoid axiolateral projection. First is we have the Henschen method. The Henschen 15-degree method demonstrates the mastoid cells, mastoid antrum, external and internal acoustic meatus shown in figure 23-17. This approach was recommended by Henschen and later by Cushing for demonstrating tumors of the acoustic nerve. Patient position. Place the patient in the prone position or preferably sit the patient before a vertical grid device. When the mastoid cells are the point of interest, tape the auricles forward. Part of position. Place the patient's head in true lateral position with the mid-sagittal plane parallel with the plane of the IR and the interpupillary line perpendicular to the IR plane. Adjust the flexions of the patient's neck so that the IOML is parallel with the transverse axis of the IR. Immobilize the head and respirations is suspend. Next is we have the Schuller method. Schuller method, 25-degree method, demonstrate the pneumatic structures of the mastoid process, the mastoid antrum, the external and internal acoustic meatus, the sinus and dural plates, and when present the mastoid emissary vessels shown in 23-18. Next is we have the Lysholm method. The Lysholm 35-degree method, sometimes referred to as the Rundstrom II method. Demonstrate the mastoid cells, mastoid antrum, external acoustic meatus, labyrinthine area, and carotid canal shown in figure 23-19. Rundstrom recommended that the exposures be made with the mouth open for visualizations of the petrous apex between the anterior wall of the external acoustic meatus and the mandibular condyle. And the last one is the AP axial projection town method. Patient position. Place the patient in either the supine or seated upright position. Center the mid-sagittal plane of the body of the midline of the grid device. Structure shown. This projection shows the petrosas projected above the base of the skull shown in figure 23-7. It demonstrates the internal acoustic canals, arcuate eminences, labyrinths, mastoid antrums, and middle ears. The dorsum sellae is seen within the foramen magnum.